Hello, are you aware that there are lots of reproductive and sexual health problems that are so embarrassing that a lot of people do not want to talk about it, not even with their doctor? And one of these problems is dyspareunia, which is also known as pain during sexual intercourse. Pain during sexual intercourse is not a common thing that is discussed in a round dinner table. Apart from the fact that it can cause problem with self-image, it can also result into relationship problem in marriage. Sexual intercourse is an important part of marriage, but a lot of women suffer pain during this process. But due to fear of the unknown, majority of women chose to live with it. But is that a solution to this problem? Pain during intercourse is very common among women at one point in time of their life. About 30 to 50% of women suffer pains during sexual intercourse, and majority of women can never have intercourse without pain, while others may never have pain and have free intercourse. Today, in this video, I'm going to discuss dyspareunia, that is pain during intercourse, the causes, predisposing factors that can expose anyone to pain during sexual intercourse, and how it can be treated. But before I go into that, let's take a little time out to subscribe right now. So stick around the channel, don't go anywhere. But turn on your notification bell so that you don't miss out. So that you'll be the number one person to get notification when I upload videos like this. You're welcome back. If you're just joining us, this is Ife Health View, where we talk about everything reproductive health. Like I said before, today in this video, we are going to talk about dyspareunia, that is pain during sexual intercourse. Now, the first question is, what is dyspareunia? Let us see the overview of what dyspareunia is. Dyspareunia is a term used for a recurring pain around the genital area or at the pelvic region during sexual intercourse. This pain may be sharp or intense, and it can occur before, during, or after sexual intercourse. Dyspareunia is more common in women than in men, and it has many possible causes, but can be treated. That's the good news about it. It can be treated. Now the question is, what are the causes of dyspareunia? What are the causes of pain during sexual intercourse? We are going to look at that. Several conditions can cause dyspareunia. In other words, there are so many conditions that can cause pain during sexual intercourse. For some women, it is a sign of physical problem, while other women may experience pain as a result of emotional problem. In other words, the causes of dyspareunia can be emotional or physical. First of all, let us look at the common physical causes of dyspareunia. These causes or these factors are physical. They are things we can see, they are things we can feel around us that will enable us know or that can help us to identify the reason why we have pain during sexual intercourse. So these are the physical causes of dyspareunia. Number 1, vaginal dryness from menopause can cause pain during sexual intercourse. Apart from vaginal dryness from menopause, another physical factor that can cause dyspareunia is childbirth, breastfeeding, or medications, or even too little arousal before sexual intercourse can also facilitate pain during sexual intercourse. The next physical factor is skin dryness. Skin disorder can cause or facilitate pain during sexual intercourse. We are going to go into that extensively. Another physical factor is skin disorder that cause ulcer, skin itching, cracks, or burning. Infections such as urinary tract infection can also result into pain during sexual intercourse. Infections such as yeast or other urinary tract infections can cause pain during sexual intercourse. The next physical factor is injury or trauma from childbirth or accident, and episiotomy, hysterectomy, or pelvic surgery. Another factor is vulvodynia or pain centered around the vulva, can also initiate pain during sexual intercourse. The inflammation of the vagina can also cause pain during sexual intercourse. So, vaginal inflammation is another physical factor that can cause or initiate pain during sexual intercourse. Another physical factor that can cause or initiate pain during sexual intercourse is a spontaneous tightening of the muscles of the vaginal wall, can also cause pain during sexual intercourse. A spontaneous tightening of the muscles of the vaginal wall can also be another physical factor that can result into pain during sexual intercourse. That's dyspareunia. Endometriosis, cystitis can also cause pain during sexual intercourse. Other physical factors are pelvic inflammatory disease. These can also result into dyspareunia or pain during sexual intercourse, especially around the pelvic region. Another physical factor is uterine fibroid. I've done a video on fibroid extensively, the causes of fibroid, how to treat fibroid, remedy for fibroid, different surgical operations that can be used to remove fibroid, and different types of fibroid and their locations. If you have not watched that video, I'm going to leave a link to that video under this video so that you can watch it and know more about fibroid and how it can be treated. But note that uterine fibroid is one of the causes or one of the physical factors that can cause dyspareunia or pain during sexual intercourse. IBS can also cause dyspareunia. That is irritable bowel syndrome. IBS is another physical factor that can cause dyspareunia or pain during sexual intercourse. Radiation or chemotherapy also can result or facilitate pain during sexual intercourse. Another important fact you should note is that factors that reduce one's sexual arousal or ability to feel the urge can also result into dyspareunia. And let us look at those factors. These factors include, number one, stress. Stress can result into tightened muscles around the pelvic floor. Another factor is fear. Fear, guilt, or shame related to sex can also cause one to have pain during sexual intercourse. That's an emotional factor. Another emotional factor is self-image or body issues. All these can result into pain during sexual intercourse. Medications such as birth control pills can also cause pain during sexual intercourse. This is why it is advisable to meet a doctor, get a proper diagnosis before you use any birth control pills to avoid complications that might result into having pains during sexual intercourse. In this category also, relationship problem can play a role. It can help or it can facilitate or initiate pains during sexual intercourse. Conditions such as cancer, diabetes, arthritis, or typhoid and other related diseases can also initiate pains during sexual intercourse. History of sexual abuse or rape can also agitate sexual pain during sexual intercourse. Now, let's look at the symptoms of dyspareunia. What are the symptoms of pain during sexual intercourse? Talking about the symptoms of dyspareunia, the dyspareunia pain varies. It depends on where it occurs. Pain may occur in the vagina, in the urethra, or at the bladder. It depends. Pain may even occur during penetration at the initial stage. In some persons, it can occur after intercourse. It can occur during or after intercourse in some persons. While in some people, it can be deep inside the pelvis during intercourse. That is where they feel their own pain. Other symptoms of dyspareunia symptoms of pain during sexual intercourse is itching, burning sensation around the pelvic region, or aching. Sometimes it comes with the feeling of stabbing pains. Now, the next question is, who is at risk of dyspareunia? Who is at risk of having pains during sexual intercourse? Both men and women can experience pain during sexual intercourse. In other words, dyspareunia occurs occurs in both men and women, but the condition is more common in women. Dyspareunia is one of the most common problems of postmenopausal women. It is a postmenopausal problem in women. It is very common among women who are in their menopause or post-menopause. About 75% of women have painful intercourse at some point in their life, at some time in their life. And you are at risk if you take medications that cause vaginal dryness, or if you have a viral or bacterial infection. That is infection caused by virus or bacteria. You are at risk of having pain during sexual intercourse. So dyspareunia is certain to occur if you have bacteria or viral infection. You are at risk of having it. You are also at risk if you are at your menopause, because it is a postmenopausal problem. It's very common among women who are at their postmenopausal stage. Now, let's look at how dyspareunia can be diagnosed. There are several medical tests that can help doctors identify and diagnose dyspareunia pains or dyspareunia problems in women. Your doctor will start by creating a history of medical and sexual history for you. Your doctor may ask you certain questions such as when and where do you feel the pain? Apart from sexual intercourse, do any other activities cause you pain around the pelvic region? Walking, running, trying to climb on a bike, trying to enter your car, any activity that has to do with the spreading out of your legs, your laps, does it cause pain around your pelvic region? These are the certain questions your doctor will ask you, and you have to be very sincere in providing the answer. Another question he may ask you is, does your partner feel pain as well? Is he in a position to help? Does he want to help? Have you discussed it with him? All these questions the doctors will ask you to enable you provide answer that will help him in his diagnosis. Are there certain conditions that may be contributing to this pain apart from the penetration? After all this, pelvic examination can now be done by your doctor. During this procedure or during this examination procedure, the doctor will have a closer look at your external and internal area of your pelvic region to identify whether there is vaginal dryness. A pelvic examination is also very common in this diagnosis. During this procedure, your doctor will have a closer examination or a closer look of your external and internal part of your pelvic region to seek for the signs of vaginal dryness, inflammation or infection, or genital warts or anatomical problems, abdominal masses or scary tissues. Remember we talked about scar tissues or scary tissues causing fallopian tube blockage. During the last video when I discussed on fallopian tube blockage, we talked about scar tissues and pelvic adhesion blocking the fallopian tube. So during this pelvic examination, the doctor will have a closer look at your internal and external pelvic region to see if there is a scar tissue that is blocking the fallopian tube, because this can also cause pain during sexual intercourse. We've discussed different causes of infertility. We've talked about sperm leakage, we talked about fibroid, we talked about fallopian tube blockage. This time around, fallopian tube blockage, fibroid, endometriosis, all these can contribute into providing pain during sexual intercourse. So if you've not watched that video on fallopian tube blockage, fibroid, which was the last video, I'm going to leave the link of that video under this so that you can watch it to enable you understand some factors that can cause the blockage of fallopian tube. And this, remember, is one of the causes of infertility. We've discussed that before. So, or if you know the causes or the factors that led to vaginal or the fallopian tube blockage, you can treat it, because most times those factors which block the fallopian tube can initiate pain during sexual intercourse. So, during the time your doctor is having a closer examination of your internal and external pelvic region, The certain signs that he will look out for is the presence of scar tissues, because these scar tissues can cause fallopian tube blockage, and these can initiate pain during sexual intercourse. Another factor he will look out for is endometriosis. I've talked about that before. Tenderness around the pelvic area. The internal examination may require speculum. This is a device used to examine or to view the vagina during pap test. Your doctor may also use a cotton swab in or to different areas of your vagina in order to locate the position of the pain. This will help to locate the position of this pain during this process. Sometimes the doctor may ask you to go and do some certain tests, such as ultrasound. We've talked about the ultrasound during fibroid in order to know the location of this pain. If the pain is caused by fibroid, then it will be noted during this process. You can as well go for culture test to check for bacteria or yeast infection during this test. Ultrasound, culture test to test for infections such as bacterial infections or yeast infections. You can as well go for urine test, allergy test. Sometimes you may go for counseling to determine the presence of emotional causes. Now let's look at how this dyspareunia is treated. What are the medications that can be used in the treatment of dyspareunia? In order to treat pain during sexual intercourse, you will need some medications. Let's look at them. Dyspareunia treatment is based on the conditions that cause it. If your pain is caused by an underlying infection or health problem or health conditions, then your doctor may treat it with either antibiotics, antifungal medicines, injectable corticosteroids, topical or injectable corticosteroids. Patient is causing vaginal dryness, then your doctor may change your prescriptions. Trying alternative medications may restore natural lubrications and reduce pain. Note that in some women, low estrogen level can also cause dyspareunia. In some women. Therefore, a prescription tablet, cream or flexible ring can deliver small regular dose of estrogen to the vagina. But this is done by your doctor. And estrogen-free drugs, Osphena acts like estrogen on vaginal tissues. Osphena acts like estrogen on vaginal tissues. It is very effective in making the tissues thicker and less fragile. And this can reduce the amount of pain women feel during sexual intercourse. In other words, dyspareunia can be reduced. Now, the next question is, are there home remedies for dyspareunia? Are there home remedies that can be used to treat this pelvic pain during sexual intercourse? Yes, there are. Let's look at them. These home remedies can also reduce dyspareunia symptoms. Number one is the use of water-soluble lubricants. Heavy sex when you and your partner are relaxed. You can as well communicate openly with your partner about this pain. Another lifestyle or home remedy that can help you to reduce this pain is to empty your bladder before sexual intercourse. I've talked about sperm leakage. One of the factors or one of the ways to reduce or to totally eliminate sperm leakage is to go and pee before sexual intercourse. Women should pee or urinate to empty their bladder before sexual intercourse. For this, to give them enough time to relax after the process, because when you get up to go and sit in the toilet to pee, it will facilitate the leakage of the sperm that has been deposited. If you've not watched that video on sperm leakage, I'm going to leave a link to that video under this video so that you can watch it. But note that when you empty your bladder, it will go a long way in helping you to reduce pain during sexual intercourse. This is because if your bladder is full of urine, the attempt to hold back the urine will agitate the muscles of your bladder and around the genital area, causing pain during sexual intercourse. So dyspareunia can be initiated by trying to hold back urine in your bladder. So it is advisable you empty your bladder before sex to reduce pain during sexual intercourse. Another lifestyle you can adopt to reduce pain during sexual intercourse is to take a warm bath. Take a warm bath before sex. This will relax and relieve your nerves around your genital area, around the pelvic region, in order to reduce or totally eliminate dyspareunia, which is pain during sexual intercourse. Another home remedy you can adopt is to take an over-the-counter pain reliever like paracetamol before sexual intercourse, but do not form it as a habit. If not, your body will get used to it, and anytime you refuse to take it, you will feel the pain. So it is not going to be a habitual thing. Just from time to time, you try to take a pain reliever before sex in order to reduce any pain that may come as a result of penetration. If you usually have any kind of burning sensation around your vulvar region, then you can apply an ice pack around the vulvar region just to calm the burning sensation and relax the nerves around the vulva in order to have a pain-free intercourse. Sometimes also your doctor may recommend another alternative therapy to this dyspareunia or in order to treat pain during sexual intercourse. Let's look at those alternative therapy that can be used. These can include sensitization therapy or sex therapy. In this sensitization therapy, you will learn vaginal relaxation techniques. Your doctor will teach you how to carry out this relaxation therapy or in order to reduce pain during sexual intercourse. During this sex therapy also, your doctor or the counselor will teach you how to be open and communicate with your partner. Communication with your partner helps a lot. If you do have pains or if you usually have pain during sexual intercourse and you keep it to yourself, there is no way you will get therapy. There is no way you will get solution to this problem. Most times, fear of unknown, most times embarrassment or shame or shyness may not allow you to speak out, may not allow you to even let your partner know that you are feeling pain during this intercourse. But the sex therapy handled by your doctor or sex therapy specialist will help you to know how to communicate with your partner. Let him know that you feel pain during this process. And this will help you to re-establish intimacy with him in order to reduce pain during sexual intercourse. Probably it could be due to the speed or position he is using. Communication is the key. Intimacy is the key. Speak out. Tell him this is where you're feeling pain. This is how you're feeling pain. So during this sex therapy, your doctor will teach you how to re-establish intimacy, how to communicate with your partner in order to reduce this pain during sexual intercourse. This dyspareunia is eating deep into so many marriages today, and it is causing more harm than good. Now, let's look at the preventions of dyspareunia. How can dyspareunia be prevented? How can we prevent pain during sexual intercourse, especially around the pelvic region? Like I said before, there are so many predisposing factors that can initiate pain during sexual intercourse. So, talking about the prevention of dyspareunia, there is no specific prevention of dyspareunia. There is no specific prevention of pain during sexual intercourse. But there are certain activities you can do to reduce the risk of having these pains. Let us look at those factors that can help you to reduce the risk of dyspareunia. Activities that can help you to prevent pain during sexual intercourse are: number 1, after childbirth, wait for at least 6 weeks before resuming intercourse. For this will enable the pelvic area to heal and the nerves will be ready for such activities before you resume sexual intercourse in order to reduce pain during sexual intercourse around the pelvic area. That is number 1. Number 2, when the issue is vaginal dryness, apply a warm soluble lubricant around your vagina to reduce dryness. That is in a case where the issue is caused by vaginal dryness. Maintain proper personal hygiene, because these can introduce infections, bacterial infections that can cause pain during sexual intercourse. So proper personal hygiene is very important. Ensure you get your proper routine medical check. Prevent sexually transmitted diseases by using condoms or other barriers so that you will reduce the risk of having infections that can cause pain during sexual intercourse. Try to encourage natural vaginal lubrication by having enough time for foreplay and stimulation. Foreplay and stimulation encourage natural vaginal lubrication. In that case, you don't need any form of synthetic lubricants that can introduce infections that may lead to pain.